So we are going to have a conversation that has been pre-recorded. So we'll get to watch another video that is focused on zooming out from the local to that global perspective, to looking at the planetary health, the systems that are affected by climate change, and how that then drives down to our local health. And then, of course, going the other direction, how our local actions can help to preserve and protect those planetary systems and the entire globe. So the two speakers that will be joining me are Dr. Marie Studer, who is the Executive Director of the Planetary Health Alliance and is also here today. There you are. And then she'll have the awkward pleasure with me of watching ourselves on video live. And then Dr. Cecilia Sorensen was not able to join us today, but she is the director of the Global Consortium on Climate Change and Health Education at Columbia University. So I'm really excited to share this conversation, and I will go ahead and kick it off. Hello, and thank you so much for joining us. I'm going to just dive right in with the first question. What does the term planetary health mean? And I'm going to ask Dr. Studer to go first.
Hi, Ben. Thanks so much. I'm really delighted to be here today and looking forward to our conversation with you and Cecilia. I'll just a bit about myself. I'm Marie Studer, Executive Director of the Planetary Health Alliance, which is part of a new cross-university planetary health initiative at Johns Hopkins University. And the Planetary Health Alliance is a consortium of more than 370 organizations in 65 countries that pulls together to work on the field of planetary health and also finding solutions and actions and mainstreaming those insights for the greater good. Just as by way of myself, I use she, her pronouns, and I'm a white woman with short brown hair wearing a blue blouse, sitting in my home office and presenting over Zoom. Ben, now getting back to your question, planetary health is both a scientific field and a social movement. And the planetary health research analyzes the impact of global environmental change on all dimensions of human health. And just for context here, global environmental change includes climate change, land use change, global pollution, oceans acidification, and global biodiversity loss. And it's all of these systems interact in complex ways to create the environment within which we live. The scale and urgency of the situation we find ourselves in requires that planetary health also be a positive, solutions-oriented field alongside a growing social movement to drive global awareness, education, and action to create a great transition or a different way in which we live on the planet, to ensure that we stabilize natural systems upon which we depend. And just to wrap up and give acknowledgement to our Indigenous colleagues and their knowledge, I think the concept of planetary health is eloquently expressed in a statement of the United Nations Permanent Forum on Indigenous Issues as the health of the land and peoples are synonymous, nurtured through relationships with the physical and social environments.
Thank you. And Cecilia, I'm going to bounce it over to you.
Thanks so much. My name is Cecilia Sorensen, and I am an emergency medicine physician and an associate professor of environmental health sciences at the Mailman School of Public Health at Columbia University, where I direct the Global Consortium on Climate and Health Education. The Global Consortium is an organization of over 300 health professional training institutions who have pledged at the level of the dean or head of school to train their students in climate and planetary health, which is super exciting. And in addition to having academic partners, we also partner with governmental and non-governmental organizations, because as you can imagine, we need to train this generation of health professionals, but also the current generation of health professionals, especially our health decision makers. So I'm so delighted to be here with you, Ben and Marie, to talk about planetary health and what it is and how we can propel this concept, this social movement, this knowledge base further, so we can really make this planet habitable and safe for all of us, both now and in the future. the way I see planetary health is maybe simplistic. I sort of say, we depend on clean air, clean water, and clean soil to be healthy people. And when we see that we have disproportionate access to these very basic natural resources, that huge inequalities arise, and ill health is the symptom of this. Although I sort of see planetary health as focusing on a bit on human health, it is also about focusing on the health of ecosystems, the health of animals, the health of plants, because what we know is that we are only as healthy as the environment on which we pretty much depend. And so, a lot of the work that I've been focusing on is how we translate these maybe slightly abstract, almost spiritual concepts into daily practice, into how we interact with our patients in emergency departments, how we make decisions as public health professionals, how we make decisions as policymakers. And so that translation piece is what Marie's sort of talking about, I think, in terms of the action, and how we use this to sort of frame how we organize societies, how we organize government to make sure that everybody has equal access to clean air, clean water, and clean soil. So thanks so much, and looking forward to this conversation.
Thank you. And that flows really nicely into my next question. Something I experience this a lot when I go out and talk with health professionals, whether they're clinicians, public health workers, students, or professors, that climate change can feel just too big, too complex, too far outside of their control for them to add it on as one more big thing for them to deal with, one more thing for them to think about or advocate for that feels, again, just separate and big. So how do you emphasize this additional context, connections, and broader perspective while keeping people motivated to take that individual action without kind of divorcing them from that on the ground next step?
Yeah, I mean, that's a great question, Ben. And I think there's so much like feeling of despair and feeling that what could we possibly do about this? And I think, from my perspective, we deal with this anyway, whether we like it or not. It is not something that is separate. And I'll just give you an example. I was working in the emergency room last week and had a 92-year-old gentleman come in with heat stroke. He did not have air conditioning in his apartment. He was wheelchair bound. His family didn't know what was wrong with him, and he came in with heat stroke. Right. And so this is something that we're seeing every day more and more in our clinical practice, as nurses, as pharmacists, as public health professionals, as health administrators. If we are not ready to diagnose and rapidly treat these types of very time-sensitive conditions, the populations that we have taken oath to protect and care for are going to suffer. And so I think if we see planetary health as something separate, yes, it becomes harder to tackle. But if we see it as integral to human health, it's a lot easier. One of the things we do at the Global Consortium is we provide a ton of resources for health professional training institutions to be able to seamlessly integrate planetary and climate and health into their curriculum. So for example, if you're teaching students about asthma, which every health student learns about, we need to be talking about air pollution, which is a cause of onset of childhood asthma and is a major factor that exacerbates chronic obstructive pulmonary disease and other types of respiratory diseases. And so what we can do is we can work alongside existing curriculum to make sure that our health professionals are trained to understand the current paradigm. How do we stay motivated? I think the students keep us motivated. I think that the youth are a force. They are demanding it in their educational systems. The Planetary Health Report Card, if you haven't heard of it, they're coming to your academic institution soon to grade the institution on how well they're integrating planetary health concepts into education. So that's where I derive a lot of my inspiration from. So I'll just stop there and pass it over to you, Marie.
Thanks, Cecilia. Yeah, I can't agree with you more. And I think the idea that you mentioned that, we're part of the environment. So what happens to the environment happens to us. And I think that while global environmental change is huge, it is complex, but it's reached a scale that it is driving a significant fraction of the global burden of disease. So despite its complexity, we just can't ignore it. And Cecilia, just echoing exactly what you said. I think that also by paying attention to it, then we can begin to look out for changing patterns of disease, identify particular vulnerabilities. And like Cecilia just mentioned, in terms of her patient with heat stroke, so trying to connect the dots there. And in that way, we can then prepare interventions, right? And we can reduce those burdens of disease, and we can prepare and adapt to create a livable future, because it's going to take everything from the proper healthcare, if you will, but to going back home to a livable environment as well. So I think those are the things. I also think that in terms of, we should also remember that systems like biodiversity and systems such as hot springs and otherwise are also sources of traditional medicine and drug discovery, right? So that's another angle to it, meaning that the environment within which we live also, it just provides for us in many, many different ways. So Cecilia mentioned clean air, clean water, but the biodiversity is the very fabric of the planet and provides us with many resources for building, for medicine and otherwise. And so I think those are things that we really want to take into consideration. And secondly, I think that we find at the Planetary Health Alliance, there's a spectrum of practitioners that engage with this. And I think everybody is maybe in a different place on their journey in terms of understanding the relationship between health and the environment. But people are really becoming much more aware of that, becoming very motivated, and to understand what environmental change means for their practice and their patients. And I think that overwhelmingly practitioners want to do their job, as Cecilia said, in terms of the oath that they took to keep people safe and well.
Yeah, I'd really love to hear more about how practitioners change their work, how they change their practice, their engagement with patients, their engagement with community, given that understanding of the connections and the systems of biodiversity, of all of it, that there's so many interconnecting systems. Do you have any examples or stories of practitioners making that change, of practicing in a different way?
Yeah, absolutely, Ben. And I think we can think about this in terms of bedside care all the way to how public health practitioners are practicing medicine. I mean, every different specialty is going to make this work for them. Some examples of this, I mean, there's so many great ones, but for example, OB-GYNs now are providing guidance to pregnant women in terms of how to stay safe during heat, because we know that heat exposure is associated with a risk of preterm birth, of stillbirth, and other types of complications. And so incorporating that into anticipatory guidance for pregnant women is something that is happening more and more, and resources are being developed to be able to do that seamlessly. Similarly, we're seeing pediatricians thinking about climate-related exposures that are relevant in their area and doing that when we give preventative guidance, right? Do you have guns in your home? Do you wear your seatbelt? And, are you aware of the risks of heat illness, or does your child have asthma, and where do you live? Are you being exposed to indoor or outdoor air pollution, right? These are becoming more like building blocks of preventative care. I think there's, we're seeing right now is that we're really moving towards this place of action. I think even in my short time in this field, 5 years ago, it was very much around, we need to understand what the impacts are. And that's true. We do need to understand what the impacts are, but more and more, we need to understand what adaptation interventions are evidence-based and are most high yield, right? Because that's where we have our biggest evidence gap right now, is in what we can do about it. And so I think this is an area of a lot of rapid innovation, but that we need more investment in research so we understand, for example, do cooling centers work? How do you best message risks of flooding or risks of heat or risks of air pollution to patients and to communities? We have best practices from public health to guide us, but we need to learn more. And furthermore, we need to adapt our solutions and make sure they're tailored to the communities which we serve. And the best way to do that is to involve community members in these types of assessments and in this type of decision making. So I think that it's an exciting time, but that we really need a whole of health sector approach to really be able to understand what the most effective steps we can take right now are.
Yeah, and if you don't mind, Ben, I'll just jump in and again echo everything that Cecilia has just mentioned. And maybe I'll also just take a slightly different take, that in addition to looking at those interventions and adapting to the situations, there are also there's a huge movement in terms of like greening healthcare practices itself, right? So healthcare practitioners are looking at their offices, their environments that they work in, and saying, okay, so what are we contributing to the problem, and how can we potentially change that? So that's another avenue outside of strict patient care that practitioners are often looking at. I think you just mentioned, Cecilia, working on with communities and getting them involved and asking them maybe what they need. And so that's another big area of involvement that we see is asking the community what they need and helping them to either organize or somehow increase the advocacy for change in a positive way for their community environment and maybe the bigger either regional or national or global scale. So I think the other really important point here is that care practitioners are some of the most trusted voices, right? And both meaning in terms, and they touch nearly everyone on the planet, right? So it both in terms of trusted voices as caregiver to patient, but also out in the world. And so in terms of speaking, with urgency and evidence-based messages to decision makers and policymakers. And so I see more and more clinicians and practitioners, really willing to take up this advocacy role.
And I want to do a plug here for Climate RX. If you haven't seen it yet, is a badge that health practitioners can wear alongside, their name ID badge, which is subtle and just says, talk to me about climate and your health. And has a QR code and can be a way to sort of, if there's time, if the patient wants to engage, it can, in a non-confrontational way, sort of say, are you worried about it? Have you thought about it? Do you have questions about it? And so, I think we're finding more and more innovative ways to bring this into our health space. And, working alongside hospitals and health systems is a really exciting way that I think a lot of health professionals are finding, active meaning in this work. Just this past spring, we ran a life cycle assessment for the health sector boot camp and had, 15 teams from across the country taking on projects, looking at how they can best decarbonize processes in their hospitals, as well as the utilization of different medical pieces of equipment. And of course, we have ongoing through the consortium to really upskill the current health workforce to be able to help hospitals and health systems make better decisions. Because again, this is a time where we need best practices, we need information, and we need to be communicating that information ever more so.
It's really exciting to hear about young people starting off their careers with more and more tools, more and more training. At the same time, we're building the plane that's already in the air while we're building the plane that's getting ready to take off. So it's a lot of exciting work, like you said. So I think that this flows into my next question here, which is that it's been the impacts of climate change, both globally and locally, really feel like they've been accelerating the last couple of years. This summer had a lot of intense climate related disasters. Last summer did too. We expect this to continue. I'm curious how this is changing the work of Planetary Health, how it's being seen, and kind of what you expect to continue to change about this.
In some ways it doesn't change anything, and yet it changes everything, I guess, because Planetary Health and the Alliance's work itself has always been global. And we recognize that there are, impacts across the world that impact people's everyday lives and everyday health. But how that shows up, it shows up differently in different places, right? So the important part is that the scale of the problem that we're facing needs to have an equal scale of solutions. And so I think having a global understanding of the scale and urgency turns this into sort of a universal challenge. And I think that I'm hopeful that this actually brings people together for significant sort of collective and transformational action. And I think having a unified framework to see that the Earth crises is driving a global health and humanitarian crisis really creates a way for people to have a comprehensive conversations and be able to work together on urgent issues to stabilize our natural systems, understand inequities, work for social justice outcomes. And I also think that the global diversity of experiences and ideas that come together in this conversation or in these multiple conversations is exactly what we need to find creative and workable solutions at multiple scales, because it goes everywhere from the very, very local to the global scale in terms of what needs to be addressed.
Yeah, Ben, I mean, it's like you can't pick up the newspaper and not see a climate related or planetary health disaster, actively unfolding. And, I see this current situation. I mean, each of these moments are teachable moments. There are moments when you have the attention, if only for a few days, of a population of the world to sort of say, here is what is happening, and here's what could happen even more so in the future. And so we need to use these as teachable moments. And I think some really interesting organizations out there, I'm blanking on the name, based at George Mason University, run by Ed Maybach, educating meteorologists and journalists to be able to tell the story in the right lens is so important, right? We need to be thinking about how we work with media to tell the stories in ways that people understand. I think one thing I wish we saw more of in the news are the good stories, right? Because we focus on catastrophe, and it's true and it's real, but we increasingly have more and more incredible solutions that are coming forth. And so my hope is that we're able to sort of balance these two, that we're able to present this as a crisis, but that we're able to say, and we are human beings with this incredible capacity for ingenuity, for collaboration, and this is what is happening. All these things are incredible. I mean, the US alone, you can look at the Inflation Reduction Act and say, it has a lot of problems, a lot of, if we don't do this right, it might not go well, but this is the largest investment we've had yet in developing, climate resilient infrastructure. And if we do this right, it could be really good. So I think we need to tell the good stories as well as the reality of the situation that we're in.
And so,
yeah, I couldn't agree more.
I'm sorry,
Ben, I'm just going to jump in because I think changing the narrative is so important. We have to help people, open up their imaginations or reimagine what is possible, right? Not accept the doom and gloom, if you will, but say, wait a minute, we have a choice here. And and also, as Cecilia mentioned, let's highlight and show the solutions that are already at our fingertips, right? And that we can implement or that have been implemented, and the changes that have been made. And, it is going to be always a long-term haul, but that's not to say that we're not making some great progress right now.
I think that's great. I want to thank you again both for your time and your expertise, sharing it with this group. Dr. Sorensen, Dr. Studer, thank you so much. And to close out this conversation, what recommendations would you offer to the health practitioners, clinicians, public health workers, academics here in this room who care about climate change and its global impacts and want to start acting on those solutions that are out there right now?
That's such a great question. I think there's this finding your place in this is really important. And it's kind of that overlapping Venn diagram of what you're good at, what really drives you and gets you out of bed, and what you want to do, right? So not trying to find something that you're not suited for, but finding the thing that really drives you. And so, for example, if you're in an education space, if you're in an academic university, connecting with students, starting to develop some lecture materials to teach in your courses. If you work in a healthcare facility, connecting with your sustainability officer, connecting with other like-minded health practitioners in your space to sort of say, what can we do here? If you're in the research space, there's a lot of emerging information about how to decarbonize your lab, or just incorporating some meteorologic variables in your epidemiologic research to say, well, is there a signal here related to climate or environmental change? I think all of us, no matter what, need to get more education. We need to educate ourselves. We need to educate each other. We need to have more conversations like this. We need to educate our students, our patients, right? This is a time of rapid knowledge creation. And I would just sort of say, educate yourself, right? Find those places where you can connect and find what you're good at and find what you enjoy.
Yeah, that's terrific. Thank you, Cecilia. I think also I just want to, one of the closing things is just to say, remember that you're not alone, right? So I think that there are so many people out there, whether they're healthcare practitioners and caregivers, to the youth, to everybody on the planet, who actually really want to make positive change. And so this, knowing that we have this thoughtful, diverse, and even joyful community that's working on a really hard problem, can give us the courage to go forward and to, as Cecilia said, find the thing that you love to do and do it in service of the health and well-being of the planet and future generations.
Great. Thank you again so much. We really appreciate your time.
Thank you.
Thank you again, everyone. So I'll just note that this was really helpful for me to be in this conversation. My whole career has been really focused on local health. If you want to have a conversation about how healthcare for the uninsured is financed in any of the counties circling this area, you can come find me. We can talk for 45 minutes or longer if you really want to get into the weeds. But focusing on those planetary health systems and connections, that is new for me. That feels like one of those things that's not my area of expertise. And understanding this as digestible, that these are things that I can do